When I take care of patients in the hospital, I see problem after problem with our healthcare system. Those gaps in our healthcare system are what keeps me going. I'm a doctor because I want to make healthcare work better through innovation, through policy, and by being on the ground taking care of people. Thomas Jefferson believed that health and education were cornerstones of our democracy. He believed that you had to have a healthy, well-educated population to participate in the conversation. That commitment to keeping people engaged in the process of democracy is what the Soros Fellowship is all about. The core experience of the Soros Fellowship is being part of a community of people who are committed to making this country work better, but also who understand where I come from. Medicaid is the same problem that Medicare does. 16% As a teacher, I feel this incredible sense of satisfaction when I've been able to guide students in a way that makes them a better doctor, a better citizen, a better person. That's a lot of what my teaching is about. How do we make our healthcare system work better, and how do we fit that into the busy lives of a practicing doctor or a practicing healthcare professional? As a medical student, I didn't have exposure to how to lead organizations, how to run organizations, and I certainly didn't have a lot of exposure on the dollars and cents of healthcare policy. Going to business school was a chance to develop managerial skills, and it was a chance to learn the language of healthcare policy. I remember as a medical student, I'd go into a patient's room and I'd go over their list of medications right before they had to leave the hospital, and this glazed look would come over their eyes. They had no idea what I was talking about. PictureRx is a way to simplify healthcare information. We take information from an electronic medical record or a pharmacy management system, and we convert it into a much easier to read format. My dream is that PictureRx sets a new standard for how we communicate with our patients. I am in an incredibly privileged position to be able to help people get better and to be able to identify ways that the system can be made to work better for them. My parents came to the States because they were looking for a better life. Part of a wave of Indian Americans who came to this country looking for a new opportunity, particularly in the medical field. My father came with a suitcase full of clothes, $9 in his pocket, and a medical education. And that made the difference between where he is now, where we are now, and where so many other Americans are. That gap, that need for education and that access to opportunity is something that I feel a responsibility to help other people have access to as well.